Okay, so we're going to talk about the Cancer Good News Project. This project was part of a grants program funded by the Cancer Institute in 2012. It started, and it went through to the end of to the end of last year. Yep. The main aim of the program was to address issues of stigma about cancer in CALD communities. This project focused totally on the Illawarra and on the Macedonian and Serbian communities. So the background to the project is, as some of you may already know, there's a very strong stigma associated with cancer in most CALD communities. Cancer is basically related to death. People have a range of cultural myths or misconceptions around cancer, and also there's often a very serious taboo around even speaking about cancer or saying the word. Of course, as cancer health professionals, we're very concerned about the implications of this, particularly around attendance at screening and also delays in seeking help and therefore late presentation. So the project was run by the Multicultural Health Service down at the Illawarra, the Centre for Social Research at the University of Wollongong, and it partnered with the Cancer Council in the local area and also with the Cancer Care Centre. As you can see, a lot of formative research went into the project. They did 8 focus groups with members of the Serbian and Macedonian communities around a broad age group, across a broad age group. They looked at their beliefs and attitudes about cancer, the nature of stigma and myths associated with cancer, and also their screening knowledge and behaviours. There was also ongoing consultation with a panel of community members, which proved quite crucial to the project, and I just want to emphasise that point for you today. Those people in that panel were community leaders and also bilingual community health workers that were really well known and respected in their communities and were very influential in changing behaviours of communities by the end of the project. So the formative research told us what we already knew from other research, and that was that cancer is very feared in the Serbian and Macedonian communities. It was linked basically to death, and people had mixed views about what caused cancer, but certainly some people thought it was related to bad luck. There was a sense of fatalism and destiny, and very much a sense that once you have cancer, nothing can be done about it. And as I mentioned earlier, we confirmed that for the Serbian Macedonian communities, like many CALD communities, it was very difficult and people felt very uncomfortable talking about cancer. So the aims of the project was to reduce the stigma associated with cancer, develop partnerships with the local communities, develop relevant, culturally appropriate resources, and I think I would add to that list also really empower the community to take on this issue themselves, and something that the project has been very successful in achieving. We also aim to reduce stigma and taboo, open up discussion about cancer in the communities. We can't do anything about this issue if people don't even want to actually say the word or talk about it. And one of the main ways we did that was to open up positive discussions around survival and screening stories. And I might just have a little aside there. When this project started, it was not possible to find one person in these communities that was willing, as a cancer survivor, to share their story. Not one person wanted to let other people know that this had happened. By the end of this project, we now have communities that have produced resources with real people, sharing their stories, putting on their real names, having their photographs featured, and 12 months after the funding finished the project, this very month, these communities, without further funding, have actually initiated 2 huge events down in Wollongong to promote cancer screening and cancer awareness. So just at that early stage, I want to give you an idea of what you're about to see, what it has actually achieved. So it was very important, like with many called health initiatives, to engage community champions and really get that storytelling going in the community. That was really a critical way to engage the community and get their interest. As I said, there was a focus on increasing the community's capacity to address the issue itself at a local level and really build partnerships, not just with the communities, but also with those local cancer services and with the local cancer council. So we had to turn that message about cancer equals death into a message about good news. And so that's why the project team decided to label the project the Good News Project, and information about cancer and cancer screening became good news facts. So that's an example of some of the information that was promoted through the project. The main two areas of focus was to present good news around breast cancer survival and screening, and also the positive impact of bowel screening on bowel cancer outcomes. And you can see there local people being used with the messages that they themselves wanted to provide to their own community. So the good news stories were very important addition as well as the good news facts. And again, it's very much the stories about local communities. We've got the website details, and you can go to the website and hear the stories and see the resources available on there. But we won't do them in this session because of the limited time. So again, the project used a number of very typical resources that we know work well with called communities, radio scripts. They were developed in consultation with the community, so they were engaged in actually deciding what the radio scripts would say. They featured in them, we had little video vignettes that went onto the website which featured the local community members acting out little scenes related to screening and encouraging people to screen, which are quite amusing if you do have a chance to go back and have a look at those. There was a really important need to get detailed information, but in a very simple format. So community newsletters were created, and all the information I've referred to above was developed in English and also in the community language. So it meant that people from the second generation could also be informed, even if they didn't read Macedonian or Serbian. The other thing that was developed was a PowerPoint presentation which is used by bilingual health educators at community health information sessions. And I mentioned before the website, which is a hub, I guess, for both the community, but also a really great resource for health workers to go to and refer to in terms of accessing some of the resources that they could then use with the communities, not just in the Illawarra, but in other areas as well. So in terms of evaluation, which was an important component of the project, 7,000 breast cancer newsletters were disseminated. They had, again, all featured those really positive stories from the community, messages reinforcing and encouraging women to go and screen. Now, you can see there the next point is about a local event. It was a forum about breast cancer and breast screening. It was in Wollongong, only for the Macedonian community, but we had 391 people attend that event. And I think any breast screening event would be, happy to have that number of people, let alone that number of people from one community in one very specialised geographic area. So it really shows the impact that the project had in engaging the community, in making them want to deal with this issue themselves. 23 community members shared stories or photos for resources, and for those of you who've worked with called communities around cancer, you know that's a big achievement. It's really, really hard to get people to speak up and talk about cancer, as Debbie from the Cancer Council nodding her head there. So it is a great challenge for us, but it is a great achievement of this project that they managed to really turn the views of the community around to get those people to come forward. We've had 317 visits to the website, and the local community radio actually really engaged with the breast cancer message and played the radio vignettes for around 4 months. So that really helped to get that reach across. Some of the feedback from the evaluation survey, obviously you can see there yourselves, it definitely grabbed people's attention. So they thought it was relevant, they thought it was convincing. The stories were really, really important and were relevant and meaningful to community members. You can see here some of the feedback directly from people around how they actually started to feel less afraid because they had some facts about cancer, some information that before this project just hadn't reached their community. I'll just share one little anecdote. What we found was happening through the project was that, for example, because cancer wasn't discussed, people would only find out that someone would have cancer after they died or just before they died. And so it gave this kind of impression that you get cancer, then suddenly you find out that you're at their funeral. And of course it reinforced that message. And what wasn't happening because of the stigma associated with cancer, the people in the community who were surviving, who were living well after cancer, actually were not sharing that experience with their community. So again, we can see how there's this vicious cycle of the bad news being reinforced rather than the good news getting out into the communities. So some more messages there, and people really starting, you can see the attitudes starting to shift about how people, and I found that this with other CALD communities, once you get people to actually start talking about it, they feel relieved. They're so happy that they can actually have an opportunity to open up and talk about it. So again, some more great data there. 93% of people surveyed agreed that their good news stories and information promoted positive discussion about cancer in their community, not just with themselves and health workers, but that message was actually filtering through family and friends. Great recognition of the importance of having mammograms. And people understanding how they could go and have their mammograms. And something that we like to see at the Cancer Institute, of course, is that more women who'd never had a mammogram saying that they would go and have one. So I think we've been through some of these issues, these great stories before. The other important aspect of this was how it pulled people together at the local level. So the university was able to engage with the Multicultural Health Service, with the Cancer Service, and with key cancer advocates through the Cancer Council, and really get people working together on this project, which was really great to see that collaboration happening and being very fruitful. Here we've got the lessons learned. The partnership component was very important. Critical, not just very important, but critical was the involvement of those biocultural health workers who provided that capacity to engage and insights into the community. The community leaders and role models who continue to support cancer awareness and screening initiatives in the local community. The research component, which was really, really important as well in terms of giving us that community engagement, the tailored cultural resources that we needed, and very importantly, that community ownership of the project that we have achieved, and so that therefore is now playing out this month with those extra events. The thing I would add to that is please be aware it did take time. We originally funded the project for 12 months. It took time to get traction, and certainly I think that 18 months to 2 years is a more realistic time frame. But to get some of these outcomes and to get sustainable outcomes, where now without additional funding, with very limited support from the health system, the communities are owning this issue and they're going out there and they're taking responsibility for changing cancer and screening behaviours and attitudes to cancer in their community.